Good afternoon. My name is Dr. Dinesh Kumar. Dr. Dinesh Kumar. I am going to present here anatomy of pharynx from Sri Lakshmi Narayana Institute of Medical Science affiliated to Bharat Institute of Higher Education and Research, Pondicherry, India. Okay, so today we are going to talk about the anatomy of larynx. Okay, larynx is the voice box, so mainly for the purpose of phonation and respiration. See this is the larynx of the image. So you can see the larynx is located in front of the neck at the level of C3 to C6 vertebra behind the cervical vertebra. Okay, so below the larynx you can see the one butterfly shape. This is the thyroid gland. The continuation of larynx is the trachea. Above the continuation of the larynx is the laryngopharynx. Okay, so we will discuss detail about that larynx. So what is larynx? Larynx is the upper expanded part of the lower respiratory tract. So it is modified for producing voice, and it is also called as voice box or organ of phonation. So the voice box is very important of the larynx. So it is a modified producing of the voice box. Hence it is also called as voice box or organ of phonation. So act as your sphincter of inlet of lower respiratory tract to protect the trachea and the bronchial tree from entry of any material other than air. So, if this protective role is dearranged, the larynx is going to be incompetence. Result and fluid and food may be aspirated into the trachea. See, this is the sagittal section of the larynx. So, head and neck. So, upward for this is the trunk. Below the trunk, you can see the epiglottis. Epiglottis, the continuation, you can see the larynx. The larynx, you see the vocal cords. So below the larynx, the continuation has a trachea. Okay. So now we discuss about the location and extent. So where it's located, the larynx. The larynx is located anterior midline of the upper part of the neck in front of the laryngopharynx. So the normal length or average length of the larynx is about 4 to 5 centimeter. So it extends from the root of tongue to the trachea and lies in front of the third, fourth, fifth, and sixth cervical vertebra. In children and females, it lies at the little higher level. So see this is the sagittal sections. So this is the posterior side, this is the anterior side. So you can see the cross section or sagittal section of the head and neck. See this is the epiglottis. Okay, this is the epiglottis. So the continuation of the epiglottis, you can see this is the larynx. The anteriorly, you can see here the cricoid cartilage. The cricoid cartilage is a ring. It's surrounded by the larynx. Okay. The average length of the larynx is 4 to 5 centimeter. The where it begins, so begins C3, C4, C5, and C6 vertebra at the level of cervical vertebra. So other than the function of the larynx is your phonation, respirations, protections, and deglutition. The four major functions produced by the larynx. Okay. Next, the size of the male and female of the larynx is differs. In male, the vertical, transverse, and anteroposterior diameter. So vertically, the male 44 millimeter, transversely 43 millimeter, anteroposterior as a 36 millimeter. In female, the vertically 36 millimeter, transversely 41 millimeter, anteroposteriorly 26 millimeter. So in males, the characteristic puberty pubertal growth of the angle of thyroid cartilage, we called as Adam's apple. So makes the voice louder and low pitched. So some protrusions. So because the two prominent is going to be narrow, so forming an angle. That angle we called as the Adam's apple. Okay. Next. So the skeleton. So larynx is the structural framework of the skeleton. Structural framework of the skeleton. So it consists of series of cartilage which are connected to one another by ligaments and the fibrous membrane and moved by a number of muscles. The principal cartilage of the larynx or cricoid, thyroid, and the two adenoid. The hyoid bone is closely attached to the larynx with distinctive functional roles. See, this is the anterior view, this is the posterior view, this is the lateral view. So, the anterior view, you can see this is the epiglottis. Here, you can see this is the hyoid bone. So, then below the hyoid bone, you can see this is the thyroid cartilage. Below the thyroid cartilage, you can see here this is the cricoid cartilage. Okay. So, this color indicates the thyroid gland. So now we talk about the cartilage. There are nine cartilage composed, which there are unpaired, three unpaired, and three paired. The unpaired cartilage are thyroid, cricoid, and epiglottis. The paired cartilage are adenoid, corniculates, and the cuneiform bone. So cuneiform cartilage. Sorry. So the three paired and three unpaired. Okay. So first we will discuss about the unpaired cartilage. The first cartilage we talk about the thyroid cartilage, the prominent and act as a shield to protect the larynx from the front. So this is the thyroid cartilage. This is the posterior view. So it consists of two quadrilateral lamina which meets in front of an angle called thyroid angle. We call it as Adam's apple. So in male, the angle differs from the acute angle. In females, the angle is obtuse angle. The angle measures 90 degree in male and 120 degree in female. Okay, because of the prominence of the thyroid angle. So the thyroid angle is there prominent in males, the responsible for prominence of the front of the neck called Adam's apple. The posterior surface of the thyroid cartilage in the median plane provides attachment from above downwards to the following structures. See here, this is the epiglottis. So this is the epiglottis. So this is the thyroid cartilage. So this is thyroid cartilage. You can see the posterior surface of the thyroid cartilage. The three ligaments. One is the thyroepiglottic ligament. Another one is vestibular ligament. The third one is focal ligament. Okay, the three ligaments are present posterior surface of the thyroid cartilage. So the below the thyroid cartilage, you can see this is the cricoid cartilage. Okay. The first, next we will discuss about the posterior border of the lamina of the thyroid cartilage. It's a free and prolonged upwards and downwards or the superior and the inferior horna. See here, this is the superior horna, this is the inferior horna. Okay. So here the superior tubercle, here the inferior tubercle. Okay. So inferior tubercle and the superior tubercle. The two lamina, the laryngeal forms the anterolateral aspects form the narrowing of the laryngeal prominence. This laryngeal prominence we called as the Adam's apple. The conjoined insertions to the following three muscles. One is palatopharyngeus, salpingopharyngeus, and stylopharyngeus. The outer surface of the each lamina provides the attachment to the following three muscles from thyrohyoid, sternothyroid, and the inferior constrictor. So this is the conjoint of the three muscles. The first muscle is the palatopharyngeus. Second one is salpingopharyngeus. Third one is stylopharyngeus. Okay. So here the lateral, anterolateral aspects, outer surface of the lamina getting attached by the three muscles. The first muscle is the thyroid. The second muscle is the sternothyroid. The third muscle is the inferior constrictor or thyropharyngeus muscles. Totally, the sixth muscle is closely attached to the thyroid cartilage. The second cartilage is the second unpaired cartilage is the cricoid cartilage. It is a signet-shaped ring of the cartilage with narrow anterior arch and broad posterior arch. So okay, this cricoid cartilage forms anteriorly by the narrow, posteriorly by the broad. Okay, so at the level of 3-6 vertebra and completely the encircles the lumen of the larynx. So it is considered as the foundation stone of the larynx. The posterior surface presents a median ridge and two depressed areas on each side of the ridges. See here, this is the adenoid cricoid cartilage. See here, this is the cricoid cartilage. This cricoid cartilage has the apex and the broad base. It has the anterolateral surface, a posterior surface, and the medial surface. Okay, so it has the base extends from very broad. So one process is the anterior surface. The medial aspect as the formed by the ocal process. The posterior surface is formed by the muscular process. So next one is the adenoid cartilage. This is the adenoid cartilage. It's articulate with the lateral part of the upper border of the cricoid lamina. So each adenoid cartilage is a pyramidal in shape. See, this is the pyramidal in shapes. So it has apex, base. This is the base. This is the apex. It has three surface. Posterior surface. Next one is anterolateral surface and the medial surface. The three surface and two process. One is the muscular process. Another one is ocal process. This is the ocal process. This is the muscular process. Next is the epiglottis. So it is a leaf-like structure. It extends behind the hyoid bone and the base of the tongue. See, this is the leaf-like structures. So you can see this is the epiglottis. So it has apex and the base. Okay, it has apex and base. Okay. The extends beyond the hyoid bone and the base of the tongue. The broad upper end free from the upper boundary of laryngeal inlet. The lower end is stalk pointed and is connected to the posterior surface of the angle of the thyroepiglottic ligament. So this green color indicates the thyroepiglottic ligament. The depressions on the each side of the median fold we called as vallecula. Okay, so this is the structures of the epiglottis. Okay, it is a leaf-like structures. So it has two ends. One is a broad upper end. So the stalk or narrow of the lower end is directly attached to the posterior surface of the thyroepiglottic ligament. So next we go to the corniculate cartilage or corniculate cartilage of Sandorini. So these are the two small conical nodules which articulate with the apices of the adenoid cartilage. So they are directly prostromedially and lie in the posterior part of the aryepiglottic fold. See here, this is the corniculate of the Santorini. So it is a conical nodule with the apex of the adenoid cartilage. So it lies in the postromedially and the posterior part of aryepiglottic folds. So next ligament and next cartilage is a cuneiform cartilage. The other name of the cuneiform cartilage is a cartilage of Wersbach. So it is a tiny rod shaped cartilage lying in the posterior part of the aryepiglottic fold just above the corniculate cartilage. See, this is the cuneiform cartilage. Below the cuneiform cartilage, you can see this is the corniculate. So below the corniculate, you can see the adenoid cartilage. Okay, these all cartilage are present in the posterior aspect of the thyroid cartilage. Okay, it forms the joints. Okay, the name of the corniculate cartilage we called as the cartilage of Sandorini. The name of the cuneiform cartilage is a cartilage of Wersbach. Okay, these two important cartilage is very important. So these are all the unpaired cartilage. So next we can see the types of laryngeal cartilage. So what are the types? The thyroid, cricoid, and basal part of the adenoid cartilage are composed of the hyaline cartilage. So here see this, there is a higher form made up of hyaline cartilage. So apicus of adenoid cartilage and the other cartilage epiglottis and corniculate and the cuneiform are made up of elastic cartilage. The two types of cartilage present in the larynx, one is the hyaline cartilage, another one is the elastic cartilage. The hyaline cartilage is mainly formed by the thyroid, cricoid, and the adenoid cartilage of the basal point. The apex of the adenoid cartilage and the other cartilage, epiglottis and the corniculate and the cuneiform are made up of the elastic cartilage. So now we can move the joints. You can see here what are the joints forming in the larynx. The laryngeal joints include the pair of cricothyroid, cricoarytenoid, and the actinocorniculate joints. So this is the lateral view of the larynx. You can see the red highlighters. The small highlighters, you can see the actinocorniculate joints. Below the adenocardial joints, you can see the junction between the two area, the cricoarytenoid cartilage, between the cricoid and the arytenoid. The last one is the cricothyroid, the thyroid to the cricoid cartilage. So now we can see here the first cartilage, cricothyroid cartilage. So how it forms, what type of the joints? It is a plain synovial joint between the inferior corona of the thyroid cartilage, okay, and side of the cricoid cartilage. Okay, this is the cricoid cartilage. So this is the inferior corona of the thyroid cartilage. Okay, so this area is very important because the laryngeal nerve enters very close to this joint. The main function of this main movements of this joint has the rotatory movements and the gliding movements. Okay, so this is a very important. The second joints you can see the cricoarytenoid cord joints. Okay, there's a tiny plain joints, synovial joints between the base of the arytenoid and the lateral part of the upper border of the lamina of the cricoid cartilage. Okay. Next, it's at two movements. One is the rotatory movements, another one is the gliding movements. The rotatory movements mainly occurs by the vertical axis, the subducting and the adducting of the ocal folds. Next is the gliding movements. It's a closing or opening the posterior part of the glottis. Okay. So see this is the cricoarytenoid cartilage. So forming by the platine planosynovial joints between the base of the arytenoid. So this is the arytenoid, base of the arytenoid and the lateral part of the lamina of the cricoid cartilage. So its function is mainly for the two movements. It allows two movements. One is the rotatory movements, another is the gliding movement. The rotating movements occurs mainly for the vertical axis, the subducting and adducting of the adducting to the ocal cords, the gliding movements closing or opening the posterior part of the glottis. Next is the actinocorniculate joints. This type of the synovial joints between the arytenoid and the corniculate ligament, corniculate cartilages. So you get the small dot of the conical shape. So the mainly attached to the apex of the adenoid cartilage. Okay. Next, we comes to the ligaments and membranes. They are interconnected by the number of ligaments and the fibrous membranes. Okay, so what are the ligaments? The one is the thyroid, hyoid, cricothyroid, quadrangular, and the cricoacal membrane. See the pictures. You can see the posterior aspect of the larynx. See, this is the hyoid bone. See here, this is the hyoid bone. So you can see below the cuneiform ligaments. Below the cuneiform ligament, this color indicates the quadrangular membrane. So on the vestibular ligament and the ocal ligaments. Okay. So now we can discuss about the extrinsic muscle. The extrinsic ligaments and membranes are outside the inner tube of the fibroelastic tissue of the laryngeal cavity. So it is classified by the thyroid membrane and ligaments, cricothyroid ligaments, thyroepiglottic ligaments, hypoepiglottic ligaments, and cricothyroid ligaments. See this image is a very lateral view. So see here this is the hypoepiglottic ligaments. So here for the hyoid bone, to here the subhyoid bursa, thyrohyoid membrane. See, this is the thyrohyoid membrane. Here the thyroepiglottic ligament. See, here this is the thyroepiglottic ligament. This is the epiglottis. Okay, so it's epiglottis. Between the epiglottis and the cuneiform bone, so you can see here the extension of the quadrangular ligament or quadrate membrane. So below the quadrate membrane, you can see here this is the cricothyroid membranes. This is the cricothyroid membrane. So mainly attached to the apex and base. The apex is attached to the adenoid cartilage. Base is attached to the posterior surface of the thyroid cartilage. Okay. Next, we comes to the intrinsic muscles. The intrinsic muscles is a part of the broad sheet of the fibrous sheet. Okay, fibroelastic sheets, which forms the inner tube of the laryngeal cavity outside into the mucous lining. The part above the sinus is called as quadrate or the quadrangular membrane, and part below the sinus is called as cricooccal membrane or the conus elasticus. Okay, so these are all the structures present inside the intrinsic of the membrane, intrinsic membrane of the larynx. See here, this is the quadrangular membrane, the cuneiform ligaments and cuneiform cartilage and cornicate cartilage, adenoid cartilage. So this sheet indicates the quadrangular or quadrate membrane. Below this membrane, you can see here, this is the cricothyroid membrane. Okay, so between these two membrane, you can see a thick fold. This thick fold we called as vestibular ligament and the ocal ligament. Next, you see here, this is the main area of the cricooccal and vocal ligaments and quadrangular membranes and the vestibular ligaments. Okay, so see here the image of the first we'll discuss the cricovocal membrane. It's an extension of the posterior surface of the thyroid cartilage to the adenoid cartilage at the base of the adenoid cartilage. So next one is vocal ligament. This ligament is a thick fibrous sheet extends from the posterior middle one third of the thyroid cartilage to the base of the base of the adenoid cartilage. Next is the quadrangular membrane. So this is the thin broad sheet. It extends from the epiglottis, upper surface of the epiglottis to the superior surface of the cuneiform cartilage. It runs towards and attaches to the posterior surface of the thyroid cartilage and the thyroepiglottic ligament. Okay, so these are the two ligament. The last one is the vestibular ligament. The vestibular ligament is already discussed. One is the vocal ligament. The other one is the vocal ligament extends towards the posterior surface to the adenoid cartilage. Next, we'll discuss about the types of extrinsic and intrinsic muscles. Okay, there are two types of muscles. One is extrinsic, another one is intrinsic muscles. All the extrinsic muscles are paired and included palatopharyngeus, salpingopharyngeus, stylopharyngeus, thyrohyoid, sternothyroid. Okay, this five muscle is very, very important to overlap the larynx. We can see here the first muscle is the palatopharyngeus, not clearly seen in this image. The next one is the salpopharyngeus. The third muscle is the thyrohyoid. See here, this is the thyroid to the hyoid bone. So thyrohyoid. The third muscle is the sternothyroid. See here, sternum to the thyroid. These muscles overlap the thyroid cartilage. So the main action of this muscle is elevate, except the sternothyroid, depress the larynx. The next is the intrinsic muscles. You can see here, this is the intrinsic muscles, the muscles that open or close the laryngeal inlet. Okay, laryngeal inlet, the oblique adenoid, or the epiglottis inlet of the larynx, and the thyroepiglotticus opens to the inlet of larynx. The muscle that abducts or adducts the ocal ligament, the posterior cricoadenoids abduct the ocal cords, lateral cricoadenoid adduct the ocal cords, transverse adenoid adduct the ocal cords. Next, the muscle that increases or decreases the tension of the vocal cord. So, cricothyroid tenses the vocal cords. Ocalis muscles tenses the vocal cords. Thyroarytenoid relax the vocal cords. Ariepiglottics and the thyroepiglottics and the lateral cricoarytenoid. So the oblique arytenoid, the lateral cricoarytenoid ligaments, and the posterior cricoarytenoid ligaments. So these are all the movements of the muscles present intrinsics of the larynx. Next, it comes to the cricothyroid and the nerve supply. So it's a fan-shaped muscle. See here, this is the cricothyroid, the adduction of the vocal cords. So mainly by the recurrent laryngeal nerve, except the cricothyroid, which is supplied by the external laryngeal nerve. So this is the cricothyroid muscles. Next, the communication of the larynx. You can see the communication is very, very important. The lumen of the laryngopharynx to the lower border of the cricoid cartilage. The laryngeal inlet is obliquely placed, sloping downwards and the backwards. So see here, this is the structures of the hyoid bone. The hyoid bone, you can see here, this is the hyoid bone. Below the hyoid bone, see, you can see the thyrohyoid membrane. So this thyrohyoid membrane continues as to attach to the lamina of the thyroid cartilage. Next, it runs towards the cricoid cartilage. Okay. So it has the two openings. One is the laryngeal inlet or supraglottis and the infraglottis. So between these two glottis, you can see here one small gap present in this area we called as the rim of glottis. Okay. So the between this thyrohyoid membrane and the aryepiglottic fold. So this is the aryepiglottic fold. So you can see here the pyriform fossa. Okay. So pyriform fossa. Next, you can see here the boundaries. The anteriorly, you can see the epiglottis. Posteriorly, by the intra-arytenoid fold of the mucous membrane. Lateral on each side, aryepiglottic fold of the mucous membrane. Within the laryngeal cavity, it has the two pair of fold. So you can see this is the image. You can see the laryngeal fold. So anteriorly by the epiglottis, posterior by the intra-arytenoid fold. So, and the mucous membranes, the lateral aryepiglottic fold of the mucous membranes. So, within the laryngeal cavity, you can see the two pair of the pharyngeal pairs of fold. The upper fold is produced by the vestibular ligaments, okay, called as vestibular fold or false ocal fold. So, this is the false ocal fold. The space between the vestibular fold we called as a rimma vestibuli. So the lower fold are produced by the vocal ligaments and vocalis muscles and called the vocal folds or the true vocal folds. Okay. So the space between the two right and left vocal fold is called as the rim glottis. Okay. So this rim glottis is the space between these the structures. Okay. It's a coronal section of the laryngeal cavity showing the subdivisions. Okay. One is the A, you can see here the vestibule. B, you can see there's a gap we called as the ventricles of the larynx. C, you can see here this is the infraglottic compartment. Next, the subdivisions of laryngeal cavity. These parts of these two pairs of the vestibular and the vocal fold. Okay, the vestibule extends from the laryngeal inlet to the vestibular fold. So it has two walls. One is the anterior wall, another one is the posterior wall. The ventricle or sinus of the larynx or the glottis compartment, also called as oil can of the larynx, because here the lot of the sebaceous, a lot of the glands are present. Okay, submucosal glands are present here. Next is the infraglottic sea instance the infraglottic compartment. So it extends from the vocal fold to the lower border of the cricoid cartilage. Next, we comes to the nerve supply of the larynx. Okay, the motor supply and sensory supply. The motor is provided by the internal and external laryngeal nerve. See here, this is the superior laryngeal nerve. Here, the 10th vagus nerve. Next is the inferior laryngeal nerve. Then the recurrent laryngeal nerve. The sensory is supplied by The ocal fold is supplied by the internal laryngeal nerve, while below the ocal fold we call this recurrent laryngeal nerve. See here, this is the recurrent laryngeal nerve and the internal laryngeal nerve. These pictures you cannot see the internal laryngeal nerve. Next, we discuss about the blood supply of the larynx, the above and below the ocal folds. So we hear the ocal folds above and the below the ocal folds. So the above the ocal fold by the superior laryngeal arteries, the branch of the superior thyroid artery. Below the ocal fold by the inferior laryngeal artery, branch of inferior thyroid arteries. Okay. Next, we'll discuss about the venous drainage of the larynx. It's very, very important. So, two divisions. One is the superior laryngeal vein, another one is inferior laryngeal vein. The superior laryngeal vein is drains into the superior thyroid vein. The inferior laryngeal vein is drained to the inferior thyroid veins. Okay, the two laryngeal veins. See here, this side runs transversely to supply the thyroid cartilage, pierce the thyroid cartilage and enters the sub drains the uh, blood. So next is the inferior laryngeal vein. It runs downwards and towards the cricoid cartilage. Then it divides into 3 to 4 tributaries. Okay. Then drains into this area. Next, for the lymphatic drainage is divided by the above the vocal cords and below the vocal cords. Above the vocal cords, pierced by the thyroid membrane, run along the superior thyroid vessels and drain into the upper deep cervical lymph nodes. So it's the anterior superior lymph nodes. Next, below the vocal cords, you can see pierce the cricothyroid membrane and go to the pre-laryngeal and pretracheal nodes, then drains into the lower cervical lymph nodes. It's a posterior inferior group. So here the same deep cervical nodes, pretracheal nodes and pretracheal nodes, superior tracheobronchial nodes and the inferior tracheobronchial nodes. Next we discuss about the rim glottitis and the phonations. It's the narrowest anteroposterior cleft of the laryngeal cavity. The anteroposterior diameter of the glottis is 24 millimeter in adult males and 16 millimeter in females. The boundaries in front, the angle of thyroid cartilage, and behind the intraethmoid folds of the mucous membranes. On the each side, the focus vocal fold in the anterior three-fifth and the post process and the vocal process of the athenoid cartilage in the posterior two-fifth. Subdivisions of the rim of glottis. It's a two-part. One is the intramembranous part, another one is the intracartilaginous part. The intramembranous part in the anterior three-fifth between the vocal cords. The intracartilaginous part is the posterior one-fifth between the vocal process of athenoid cartilage. Next is the shape of the rim of glottis. The shape and size of the rim of glottis varies with the movement of the vocal cords. So in the quiet breathing, the intramembranous part is triangular. So see here, this is the triangular in shape. The part of the rectangular. So as the intercartilaginous part is the rectangular, as the whole glottis is a pentagonal in shape. Next is during full inspirations, you can see the glottis is a widens and become the diamond in shape due to the abduction of the vocal cords. Next, you can see that during high-pitched voice, the rim of glottis is reduced to linear chink due to the adduction of the both intramembranous and the intracartilaginous part. So during the whispering, the intramembranous part is highly adducted and the intracartilaginous part is separated by the triangular gap, thus rendering the introverted funnel shape of the rim of glottis. So this is the four diagrams of the shape of the rim of glottis during the respiration. Next, the mechanism of phonations. The first one is vocal cords are kept adducted. Next one is infraglottic air. Pressure is generated by exhaled air from the lungs by the contraction of the abdominal, intercostal, and the other extremity muscles. The force of air opens the cords and releases the small puffs. As the moving air passes through the vocal cords, it makes them to vibrate, producing sound. The sound is amplified by the mouth, pharynx, esophagus, and the nose. The sound is converted into speech by the modulatory action of the lips, tongue, palate, pharynx, and the teeth. Next is the applied anatomy. So you see this is the normal structure of the tongue. So this is a larynx. This is the base of the tongue. Here you can see here median epiglottic fold. Here you can see this is the epiglottis. So below you can see here this is the corniculate cartilage, uniform cartilage. Okay. So this is the aryepiglottic fold. Aryepiglottic fold. So interior of here the larynx you can see here this is the trachea. So this is the ocal fold and vestibular fold. Okay. The space between the base of the tongue and the epiglottic fold. So this is called as vallecula. The laryngoscope, you can see here the constriction of the muscles or paralysis of the muscles or narrowing of the muscles. Okay. Next is the cricothyroid. Is an important muscles for the tone and the pitch of the voice. When the sound is about to produce, it tenses the vocal cord and makes it ready to vibrate like the tuning fork. Hence, it is also called as the tuning fork of the larynx. In case of the paralysis of these muscles following the external laryngeal nerve, lesions alters the voice cue the significantly and especially notice the singer. So that is the singer nodules. See, this is the very important muscles of the cricothyroids. Next is the safety muscles of the pharynx. The safety muscles is the posterior cricoarytenoid muscles or the only intrinsic muscles of the larynx which abduct the vocal cords to allow the entry of the air through the rim of glottis and the respiratory tract below it. So this is the posterior cricoarytenoid muscles. Next, you can see here this is the damage of both recurrent and external laryngeal nerve. The vocal cords were further abducted and fixed due to paralysis of all intrinsic muscles of the larynx. This is known as cadaveric position of the vocal cords. See here, this is the phonation and the inspirations due to the paralysis of the recurrent and the external laryngeal nerves. Next, the laryngeal obstructions. You can see here, this is the mucous membrane of superior laryngeal. Superior laryngeal part of the larynx is very sensitive. When the foreign body enters into the laryngeal inlet, it causes the immediate explosive coughing and the foreign body expelled. The patient is in the lying positions. You can see here the complete laryngeal obstructions and the tracheostomy procedures, the ET tube, endotracheal tube, and the tracheostomy tube inserted at the level of C4 and C5. Okay. So due to the blockage of the laryngeal obstructions. Okay. So next is the Asselmeyer maneuver. When you choke or obstruct the larynx, you can do these procedures. First one is the shock due to suffocations. Second, the stand behind the person. Third, make a fist with one hand. So make a fist with one hand at the thumb side. Next is the pressure, give pressure in the impact area in front of the abdomen or umbilical regions. Next example of the and position for the cross section. Next one is press the firmly on the victim of the abdomen. Okay. So slightly bend your the elbow sharply and perform the maneuver for the 5 times until the object is cleared from the airway. Okay. So this is the very important method of choking of the larynx. Anyway, any objects or any food or anything solid particles obstructs this area, so you can do this Heimlich maneuver methods. Okay. So next is the laryngeal. If the air pressure is the laryngeal sinus is raised to the trump players, glass blowers, or the weight lifter, the saccule dilate to produce air filled cysts billowing the laryngeal seal. The last one is the laryngoscopy. So the interior of the laryngoscopy can be inspected directly by the laryngoscope or indirectly through the laryngeal mirror, base of tongue, vallecula, epiglottis, or epiglottic fold, piriform fossa, the false vocal cords, true vocal cords and sinuses of the larynx between the false and true vocal cords. The last one is the singers or screamers note. So due to the singers, the overuse their voice, the teachers, pop singers, the inflammatory nodules develop at the site of the vocal nodules. So once again, the thank you. So this is the important topic of the anatomy of the larynx. Thank you.